Next we will see about another topic, subarachnoid hemorrhage, SAH, the etiopathogenesis, classification, clinical feature and management of SAH. So, SAH etiopathogenesis, there are many types of SAH, that is spontaneous SAH, mainly due to the result of ruptured aneurysm or AVM, okay, arteriovenous malformation. So, the most common site of ruptured aneurysm is in the branch points in the circle of Willis, okay, branch points in the circle of Willis. Branch points especially the ACOM. ACA ACOM is the most common site of aneurysm according to Human's Bible of Neurosurgery, but according to Bailey, it is between ACA MCA bifurcation area. Okay. So, spontaneous SAH is a result from bleeding from the ruptured aneurysm or AVM. Okay, and there is many subgroups of SAH. One is perimesencephalic SAH. So, perimesencephalic SAH, that is the bleeding is confined to the basal cistern, especially anterior to the pons and midbrain. Okay. This is mainly due to the venous bleeding, and the prognosis of this patient in perimesencephalic SAH is very good. Okay. The patient will be very fine. Okay. That is called, it is having very good prognosis. The perimesencephalic SAH is one subtype of SAH. And another type is called mycotic aneurysm. This name is called misnomer. It is not caused by fungal infection, it is caused by the bacterial infection, and a pseudoaneurysm in case of tumor, and post-traumatic aneurysms where there is a weakness of the wall. The common site of aneurysm, which is depicted in the Weylian love, is it is bifurcation of the MCA and ACA is 38%, which is the most common site of aneurysm. There is other sites of aneurysms also there. And what is the risk factor for aneurysm? One is age, female sex, hypertension, smoking, cocaine use, and the family history with at least 2 first degree relative affected. It is the main risk factor for aneurysmal bleed, and genetic disorders also predisposed to this condition. Okay. So, female sex, hypertension, age, smoking, cocaine abuse, and family history with at least 2 first degree relative affected, and genetic predisposition. The clinical features of this SAH, the typical presentation will be the thunderclap headache, which is sudden and severe thunderclap headache, and there will be a prodromal symptoms before the headache. Okay. It is representing the aneurysm having growth, okay, and there will be a subclinical bleeds. Okay. And the sudden onset occurs commonly during accession and may be associated with the seizure, loss of consciousness or unresponsiveness in 50% and vomiting in 70%. So, 1/3 of the SAH is incorrectly diagnosed at initial presentation. So, they are more prone for high risk of rebleed.